Okay, so first of all, I just want to do like a little general introduction. We're gonna start off with introducing ourselves. Hello, my name is Lauren Gonsalves.
My name is John Saboro.
My name is Frank Castro.
So
Guys,
we got hello. Oh, sorry. Can you introduce yourself really quick? Just exactly.
I'm Margarita, and I'm Pia's mom and physical therapist as well at the skilled nursing facility that you had talked about. Yeah.
Okay, perfect. So basically what our project is that we're part of HOSA, which is like a Health Occupation Students of America club at Terra. And our competition is community awareness. So our chosen health topic that goes along with that is the health detriment of elderly feeling socially isolated in like nursing homes. So basically all our questions are going to be just centered around that and just getting to know that topic a little bit more. So Giuliano, I don't know if you want to start off.
All right, so I'm just going to off with the first question. So, what is a typical socioeconomic status of the elderly that you attend?
Most of them are on Medicare and Medicaid. So Medicaid is for low income families, and Medicare just really means above the age of 65. Some of the facility that I work in has two types of patients: those that live there permanently now, and then those that come in for a short time because they've suffered some kind of injury or disease process and they need rehabilitation. So they stay there for a little bit and then are either able to transition back to home or to a different type of setting, like another skilled nursing facility or assisted living. So a lot of them are in the lower income. It's to get down to the question, but not all of them. Some of them do self-pay as well, but the majority are lower income.
Thank you.
So the question I wanted to ask is, what is the day-to-day life of these elderly patients?
Okay, so that really depends on how much they're able to do. Most of them need assistance with all of their activities of daily living because that's the reason why they're there. So it's really hard to get to that age in life. And believe me, most of the residents that we have there, their children really struggle with the decision to put them in there. It's not something that they want to do, but they cannot take care of them themselves either because they are also elderly. I mean, we have up to 100-year-old patient as well. So imagine their children are in their 80s or no 70s or 80s, and so they just can't physically take care of them anymore. And the day-to-day kind of looks like depending on their status, some of them don't leave the room. Some of them can't physically leave the room and are stuck in the bed. But the ones that are able to, the facility does try to get them to participate in social activities. It's been really tough with the pandemic because normally we have them come out and do, groups. So they do groups where they sit in the dining room and they'll play bingo or they'll do arts and crafts. But it's been really tough because, there have been times when they can't congregate too much and they kind of been staying in the room more. Since things are a little better now, they're starting to do more and more activities, but they get, typical day is they wake up, they're given breakfast. A lot of them need assistance to eat. Then they get bathed. They will then either they come out to a group if they're able to participate, or they participate in the therapies that they're scheduled for. Then they do their lunch. In the afternoon, they might do some other activities. And then kind of like by 6 p.m., they're done. They're given their dinner and they get back to bed.
Yeah. Thank you.
You're welcome.
And do the elderly there show like symptoms of social isolation?
A lot of them do. A lot of them do because, depending on the situation, our much older ones don't have anybody that can come visit them. So some of our older ones, and I can think of certain specific patients who are in their late 90s, their own children are either pretty old or have passed away. And At this point in life, they don't have many people that come visit them. So their routine becomes kind of monotonous. Every day they do the same kind of thing. And so the interaction that they get is within the facility itself. And that can be pretty much it for a lot of them.
So what do you think this type of social isolation can lead in these patients?
Definitely, many of them suffer from anxiety, depression. It's very, very common. There are moments, they go like all of us, we go through periods. But I can see many of them, a large majority of them, become depressed, anxious, sad, give up sometimes. Yeah.
Okay. And what can the youth do to support the elderly?
Well, this is where, as far as physical needs, there's a rehab program where they can get physical and occupational and speech therapy. Part of that is we try to incorporate, we bring them to the gym and try to get them to participate in activities that can be fun. Aside from exercise, it can also be exercise in a social aspect, and get them to interact with each other. They also have a recreational department where they schedule them for different activities every day. So there are some lovely ladies that schedule games, arts and crafts. Now for Christmas, we tried to decorate the whole place, and they try to get the patients that can participate in the decoration. They try to get them to do that because, like you said, this is really like most of the social interaction that they have is with each other. So they do try to do that. There's a beauty salon at the place, and so they do little things for them. They try their best.
Okay. All right. If nobody else from my group has any other questions, I think that'll be all for the interview.
Okay.
Yes.
Well, thank you
Appreciate it.
guys. I really appreciate it.
Yeah, no, we're
Yes.
here.
Thank you.
So
Thank
much
you
for
so
helping.
much.
Yes. Well, bye.
It was
Bye.
nice meeting all of you. Good luck with your project.
Yeah.
Thank
Thank
you
you
so
very
much.
much.
You're welcome.
Bye. Let me stop it.